Hi, I am Emily Daniel. Welcome to my presentation on the impact of the COVID-19 pandemic on abuse and neglect reporting and child welfare. This is for my final research project to complete my undergraduate social work program. So, what do we already know? Well, we know caregivers are more likely to harm children if there are stressors in their lives. We know that stressors can increase a child's vulnerability for maltreatment. If a family is encountering job loss, unemployment, poverty, or new life situations, the adults are at a higher risk for abusing and neglecting the children. We also know that mandated reporters make up the largest number of reporters to children's services. Mandated reporters are people who are legally required to report any known or suspected maltreatment. This may include teachers, doctors, counselors, and caseworkers. In 2020 alone, 87.5% of reports made to Warren County Children's Services were made by mandated reporters. We also know that COVID-19 mandates increase the likelihood of families encountering stressors, and that COVID-19 mandates decrease the exposure of children to mandated reporters. In April of 2020, the unemployment rate averaged 14.7%. Children were learning remotely. Of those who did not lose their job, many were working from home. Doctors were also working remotely or only seeing emergency patients. Although stressors at home are more common, increasing a child's vulnerability, these same children were not seeing the people in their communities as frequently. And then this is just a graph from a survey that I will explain later from Warren County Children's Services, and it just shows what different caseworkers and different workers stated their clients had gone through as a result of the pandemic. So the purpose of this project is to determine whether COVID-19 restrictions had an impact on the frequency of reports made to Children's Services, evaluate the severity of reports made to Children's Services after COVID-19 mandates were placed, and to compare reports made to Children's Services before and after COVID-19 restrictions were implemented. So my hypothesis is that physical abuse, sexual abuse, and neglect reports decreased after COVID-19 restrictions were placed, but the severity of the reports made were worse than prior to the pandemic. To conduct my research, I utilized two major resources. The first of these is the statewide Automated Child Welfare Information System, also called SACWIS. This is Ohio's database for all things involving child protective services. The second resource I used was a survey given to the employees at Warren County Children's Services. Using SACWIS, I collected data concerning physical abuse, sexual abuse, and neglect for 2018, 2019, and 2020. 2018 and 2019 were years not impacted by COVID-19 mandates in the state of Ohio, so I used those as baselines to compare 2020 to. The Warren County Children's Services survey was given to all the employees in the agency, and it compared the workloads and report severities from before and after the coronavirus mandates were implemented. It was a subjective survey based on the opinions of the employees. With all methods considered, this is a qualitative content analysis, combining both the quantitative report data as well as the qualitative survey. I was able to conclude whether or not COVID-19 impacted abuse and neglect reporting in child welfare agencies. To conduct my research, I used two populations. The first of these was a convenient sample of employees at Warren County Children's Services. The survey was sent to the entire agency. 35 employees out of approximately 55 answered the survey and were incentivized by being entered to win a Starbucks gift card. These graphs break down how long those who answered have been employed by Warren County Children's Services and which unit they work in. The second population was a cluster sample from the entirety of reports made to Warren County Children's Services. The categories selected are as shown: physical abuse, sexual abuse, and neglect. This graph regards the number of reports per year. In 2018, there were 236 reports for neglect, 197 reports for physical abuse, and 87 for sexual abuse. In 2019, there were 258 reports for neglect, 215 for physical abuse, and 138 for sexual abuse. Lastly, in 2020, there were 253 reports for neglect, 278 for physical abuse, and 107 for sexual abuse. These reports are only for screened-in reports, which are reports determined by the State of Ohio Revised Code to be investigated by a child welfare agency. In the survey, I asked the employees of Warren County Children's Services to consider reports of physical abuse. 65.5% of respondents had cases with allegations of physical abuse. 73.7% of respondents stated that the allegations of physical abuse were about as severe as before, whereas 26.3% of respondents stated the allegations were more extreme. Next, I asked the employees of Warren County Children's Services to consider reports of neglect. 65.5% of respondents had cases with allegations of neglect. 60% of respondents stated that the allegations of physical abuse were about as severe as before. 35% of respondents state the allegations were more extreme, and 5% of respondents state the allegations were less extreme. Last, I asked the employees to consider reports of sexual abuse. 61.3% of respondents had cases with allegations of sexual abuse. 66.7% of respondents stated that the allegations of sexual abuse were about as severe as before. 25% of respondents state the allegations were more extreme, and 8.3% of respondents state the allegations were less extreme. So, first, we do know that families did face more stressors. Although it was not relevant to my specific variables, the survey did show that the majority of caseworkers at Warren County Children's Services had clients face changes in their routine and lifestyle due to COVID-19. We also know that reports for physical abuse increased in 2020. However, the severity of cases did not change significantly. We also do not know if this is because of the lack of exposure to mandated reporters. Were there severe incidents of abuse and neglect that were unseen? And could there really be an increase in incidents of maltreatment, but the lack of exposure to mandated reporters made it seem as though there were no changes? These questions all bring up interesting points regarding the number of reports and the severity of reports. It also makes me ponder around the increase that was seen in physical abuse reports. Imagine if even more was still going unreported due to COVID-19 restrictions. Furthermore, my research was full of strengths and weaknesses. The combination of qualitative and quantitative research methods can both display changes in patterns of reporting, as well as explain these patterns. Also, I had a large sample pool to choose from for the portion that analyzed the statewide automated child welfare information system, also known as SACWIS. Because that aspect dealt with computing numbers, I was able to select from all reports made to Warren County. Also, this research is relative to current affairs. COVID-19 is still impacting our livelihoods, as well as the livelihoods of the people serviced through child welfare agencies. The results of this study could be used to help children's service agencies determine how to best keep children safe. Now, relating to my weaknesses, I do wish I would have selected data on a month-by-month basis rather than by year. Although the majority of 2020 was altered due to the pandemic, some months were stricter than others. In April, no one was in person in school, restaurants were shut down, and unemployment was at its peak. By the fall time, dine-in was available in restaurants, many people were back to work, and a large number of kids were in school in person. Also, I wish my sample was more diverse. The population of Warren County and reports made to their agency are not reflective of the state or country population at large. According to the US Census Bureau, 23.7% of Americans are a racial minority in comparison to 12.1% of people living in Warren County. Also, not all employees at Warren County Children's Services have worked there for a long period of time, and only 63.6% of employees answered my survey. So some conclusions can be drawn from my research. First, we cannot assume the behaviors of caregivers are the same as they were before the pandemic. The lack of significant change in the number of reports can lead a person to believe, based on previous literature and children not seeing mandated reporters as frequently, that there is actually an increase in incidents of child maltreatment. In times where children are not exposed to mandated reporters, experts on child welfare may need to look into ways to ensure child safety. Additionally, children's services agencies may need to conduct complete reports on a monthly or semi-annual basis. The data I gathered through SACWIS was based on entire years, but if COVID-19 has taught us anything, circumstances can change in an instant. If I were to reconduct this survey, I would do a few things. I would use a more diverse sample, like a county that reflects the population at large more accurately. I would also do it on a larger scale, such as the state of Ohio or the United States, rather than one county. And as stated in the previous slide, I would like to compare data on a different timeline rather than yearly. I do hope that my research influences the conversation on what to do in a children's services agency when an event, such as a pandemic, changes the livelihood of children. And last, I would like to thank some people. First, I would like to thank Dr. Wells for helping me conduct my research and encouraging me along the way. I would also like to thank everyone at Warren County Children's Services for taking the time to answer my survey, as well as influence my passion for child welfare, especially my field instructor, Shauna Jones. Last, I want to thank Professor Boone for initially providing me with the opportunity to intern at a child welfare agency and encouraging me along the way. If there are any questions or comments about my research, feel free to reach me at danieley@mail.uc.edu. Thank you.